So the Eustachian tube, first of all, is, and everybody knows this intrinsically. They may not have realized it's their Eustachian tube that's in play. But so whenever you fly or scuba dive, or if the weather changes, the barometric weather changes, you can get that clogged sensation in your ear, right? You feel like you have to pop your ear. Some people actually can't hear very well while that's happening. So what that is, there's a tube that connects the airspace behind your eardrum to the back of the nose. And what's supposed to be happening every second or microsecond is the outside air pressure is supposed to be equalizing with the air pressure that's behind your eardrum. And you do that by just talking, swallowing, breathing. That little tube that connects the ear to the nose is like opening and allowing pressure to do its thing. Mm-hmm. So that's why, if you're flying, your ear gets clogged, you pinch your nose, you try to blow air into that tube. Well, some people are just born with eustachian tubes that don't work very well. And a lot of those people as kids tend to get a lot of ear infections. Even into adulthood, your eustachian tubes can sometimes not work very well, and you get all these ear problems. And also folks with sinus and allergy problems, again, anything that's going to cause swelling and inflammation inside your nose and sinuses is going to affect that eustachian tube. So a lot of our patients come in with the typical allergy symptoms, typical sinus symptoms, but they can also complain of a lot of ear symptoms, clogging, fullness, hearing loss. And so we address that along with all the other things. And I mentioned the balloon sinus dilation for sinuses, but we can use the same balloon in the eustachian tube. It's a little different technique. It works a little differently, but we tend to do it at the same time that we're doing all the other stuff because, we're right there. We're literally a centimeter away from the eustachian tube opening in the back of the nose. And we use the balloon to open up that eustachian tube. And we've had a lot of patients that have really benefited. Some patients, it was in a way life-changing for them because they had to fly a lot for their work, let's say. And they had horrible experiences every time they fly, despite taking all the decongestants. And then when we fix their eustachian tubes, it's really made quite a difference. So it's just another thing that we kind of look at when we look at these patients when they come in.